Hello everyone. Today we will see about the acute renal failure. It comes under the medical and surgical nursing. In case of exam point of view, it's very important. So please concentrate on this topic. Acute renal failure. In today's topic, we will see about definition, etiology, pathophysiology, clinical manifestations and the management. First of all, we will see about the definition. Acute renal failure refers to abrupt loss of kidney function. In case of this renal failure, here what happens? The kidney is unable to remove the body's metabolic waste. So, there will be the sudden decrease in kidney function. Later it leads to decrease in the GFR. GFR means glomerular filtration rate. As there is a decrease in the glomerular filtration rate, it leads to renal failure. In case of this, there will be the decrease in the glomerular filtration rate leads to decreased production of urine. There will be an increase in the serum creatinine and blood urea nitrogen. Etiology. Etiology is of three types mainly: pre-renal causes, intrarenal causes and the post-renal causes. First of all, pre-renal causes. Pre-renal causes in the sense circulatory volume depletion, volume shift, decreased cardiac output and vascular obstruction. Circulatory volume depletion, it occurs with the diarrhea, vomitings, hemorrhage or excessive use of diuretics, burns, renal salt wasting conditions or the glycosuria. These are all the conditions which leads to circulatory volume depletion. Next, volume shift, for example, vasodilation or gram-negative sepsis or thought space sequestration of fluid, there will be volume shift. Then decreased cardiac output. During the cardiac pump failure or decreased cardiac tamponade or acute pulmonary embolism, there will be the decrease in the cardiac output. Then vascular obstruction. Bilateral renal artery occlusion or dissectic aneurysm, there will be the vascular obstruction. These are all the main pre-renal causes. Intrarenal causes, acute tubular necrosis. Acute tubular necrosis, it is the most common cause we can find in acute renal failure. Then glomerulonephritis, microvascular lesions and large vascular lesions. Large vascular lesions as the hemolytic uremic syndrome, thrombosis, vasculitis, scleroderma, trauma or atherosclerosis. These are all the major intrarenal causes. Postrenal causes, these are mainly prostatic hypertrophy, calculi, invading tumors, surgical accidents, retroperitoneal fibrosis. In case of surgical accidents such as if there is a sudden injury to the kidney, there will be the loss of kidney function. Thus it leads to the acute renal failure. Next, pathophysiology. In case of renal vasoconstriction, there will be the decrease in the glomerular filtration pressure. So, there will be enhancement of tubular water reabsorption. Continuously the water reabsorption takes place in the tubules. It leads to the tubular cast formation. Finally, the decrease to the blood supply in the tubules takes place, leads to the tubular ischemia. This finally leads to decreased GFR, thus acute renal failure occurs. Medical management. Medical management here, first of all we need to prevent acute renal failure. Second one, maintaining the fluid and electrolyte imbalance. Third, replace the renal function. Fourth, prevent the infections. Fifth, monitor the client. And sixth, maintain the nutritional status. Prevent acute renal failure. Prevent acute renal failure in the sense, here we need to maintain the adequate hydration and diuresis. In high risk clients, it is very critical to maintain the hydration. Maintain the fluid and electrolyte imbalance. Here fluid replacement must be done immediately so that we can avoid the fluid overload. Replacing the renal function. Dialysis is the frequently used one which helps in the treatment of acute renal failure. Here the continuous renal replacement therapy can be used in case of renal failure. It is again of 5 types: continuous arteriovenous hemofiltration, continuous veno-venous hemofiltration, continuous veno-venous hemodialysis, continuous arteriovenous ultrafiltration, slow continuous ultrafiltration. Preventing the infections. In case of acute renal failure, there is a decrease in the urine formation. In some cases, the indwelling catheters will be used in order to drain out the urine. As there is a continuous use of indwelling catheters, there will be the increased risk of infections. To prevent the acute renal failure, we need to reduce the use of indwelling catheters so we can prevent the infection. Next, monitor the client. Monitoring the client for the if the patient requires the critical care or intensive care, we need to observe the client continuously for minimum 12 to 24 hours. And doctors immediately need to find the cause for the acute renal failure and first try to treat the cause. Maintain the nutritional status. Here, proper position is so crucial. High calorie and low protein diet usually prescribed in case of acute renal failure. Next, nursing management. Deficient fluid volume or excess fluid volume. Imbalanced nutrition less than body requirement related to anorexia. Risk for impaired skin integrity related to edema and poor cellular nutrition. Anxiety related to the unknown outcome of disease process. First one, deficient fluid volume or excess fluid volume. Here, we need to carefully monitor the client. If the fluid balance maintenance was there or not, we need to observe carefully. Then, the measurement scale will be used that the person's weight continuously need to measure. If there is a sudden increase in the weight or decrease in the weight, we need to measure and we need to record carefully in the case sheet so that any untoward effects for the client we can observe. Next, imbalanced nutrition less than the body requirement related to anorexia. Here, we need to provide a pleasant environment to the client at the meal time. Prepare the foods in an attractive manner and present them in the small amounts so that the client can eat peacefully and the digestion process takes place. Then risk for impaired skin integrity related to the edema and poor cellular nutrition. Here, if the nutrition is poor and if the systematic process we cannot follow, that it leads to edema and it causes the skin breakdown. So, what are the nursing measures we can provide? We can provide the meticulous skin care, frequent turning the patient continuously every second hourly, and special mattress should be provided. Then range of motion exercises also need to provide so that the back sore or bed sore we can prevent. Then final one, anxiety related to the unknown outcome of disease process. Here what happens, the patients will have more anxiety. How we can avoid the disease process, how we can exit from the disease process. Like that, the clients will have more doubts. So, nurses need to provide the psychological support and emotional support so that the client can recover from the disease process easily. The neat and careful explanation reduces the anxiety for the client and the family members so that the outcome will be so effective. Thank you all.